Hello and welcome to Pregnancy Info. Today we are going to discuss the whole complete process of pregnancy. The beginning of pregnancy is when the fertilized egg successfully implants into the uterine wall. Pregnancy is a highly complex process with many stages. It all starts with the sperm and the egg. Sperm is produced in the testes of males. During ejaculation, sperm combines with seminal fluid to form semen, which is released during sexual activity. Millions of sperms are released with each ejaculation, but only one sperm is needed to fertilize the egg and initiate a pregnancy. On the other hand, eggs are produced in the ovaries of females. Every month, hormonal controls the menstrual cycle and trigger the maturation of several egg follicles, preparing them for potential fertilization by sperms. However, only one egg is released each month during ovulation. These hormones also thicken the uterine lining, preparing a uterus for the growth of pregnancy. To achieve pregnancy, the following stages must occur. Number 1. Sperm transport. Sperm must be collected and transported to the site of fertilization. The process of sperm transport depends on several factors like sperm must be able to swim effectively in the vagina. The environment must be supportive for the survival of sperm. Sperm must have the ability to change their shape to penetrate the egg cell membrane. Once the sperm enter the uterus, uterine contractions help propel them toward the fallopian tubes. Some minutes after ejaculation, the first sperm enters the tubes. However, it is not likely that the sperm will be the one to fertilize the egg. Motile sperms can survive in the female reproductive tract for up to 5 days. Number 2. Egg transport. Ovulation must occur and the egg must be picked up in the middle of the menstrual cycle. One ovarian follicle releases the egg and it starts moving through the fallopian tubes towards the uterus. Egg transport begins at ovulation and ends when the egg reaches the uterus. Number 3. Fertilization. Fertilization must occur for pregnancy to begin. After ovulation, the egg can only be fertilized for about 12 to 24 hours. Fertilization occurs in a specific part of the tube called the ampulla-isthmus junction. The contact between the egg and sperm is random and the membrane surrounding the egg called the zona pellucida has the main functions during fertilization. Implantation. The embryo must implant and grow inside the uterus after reaching the blastocyst stage. About 5 to 6 days after fertilization, the process of implantation into the uterine wall begins. Naturally, about 50% of all successful fertilized egg fails to implant. The receptivity of the uterine lining and the quality of the embryo are two crucial factors determining the success of implantation. Timeline of pregnancy. The process of pregnancy is closely related to the timing of ovulation, which can be estimated through the menstrual cycle. The exact timing of ovulation varies from women to women depending upon the length of their menstrual cycle, which can range from 21 to 35 days with an average of 28 days. The menstrual cycle is counted from the first day of one period to the first day of the next period. The process of achieving pregnancy in a 28-day menstrual cycle is approximately as I am going to describe. The first day is the first day of menstruation. On the 14th day from the first day of menstruation, ovulation occurs. Fertilization happens between 12 to 24 hours after ovulation. Around 6 days after fertilization, the fertilized egg implants into the uterine wall. Around the 21st day from the first day of menstruation, if fertilization and successful implantation occur, the woman is considered pregnant. However, a pregnancy test will only be positive 5 to 7 days later. Duration of pregnancy. A normal pregnancy lasts about 40 weeks from the first day of the last menstrual period. Pregnancy is assumed to start 2 weeks after this LMP. Therefore, there is an additional 2 weeks in the calculation of gestational age during which the woman is not actually pregnant. Pregnancy officially lasts for 10 months, mean 40 weeks due to the additional 2 weeks. Stages of pregnancy. Pregnancy is divided into 3 basic stages called trimesters. Each trimester lasts approximately 12 to 14 weeks. During each trimester, the fetus will reach specific developmental milestones and female will also experience certain changes in the body. Number 1, first trimester means 0 to 13 weeks. This is the period when fertilization and the development of the fetus major organs occur. It is the most crucial time fetal development during the first trimester. The organ systems start to form like brain and spinal cord, inner ear, heart, reproductive organs, nails, livers, eyelids, pancreas, kidneys, cartilage in hands, feet and limbs, muscles of the mouth, eyes and nose, fingers and toes, lungs. Second trimester, this is a period of rapid growth and development of the fetus. Internal organs and bodily functions become more complex during these weeks. Bone starts to harden, the skin thickens, toenails form, the nervous system begins to develop, hearing starts to develop, the part of the brain that controls motor movement is fully formed, eyelids can open and close, fetal kicks are felt more strongly, the digestive system begins to function, lungs are fully formed. Third trimester, 28 to 40 weeks. This is the period when the fetus rapidly gains weight and organs mature to be ready for birth. During this final stage of development, the fetus prepares to leave the womb. Development includes eyes can respond to change in light, the head starts to have hair, the fetus can kick grass and stretch its limbs start to look fuller, bones continue to harden, the circulatory and muscular systems are fully formed, lungs, brains and nervous systems are fully developed, subcutaneous fat continues to increase. So, this is the all pregnancy journey. After the completion of 40 weeks or 41 approximately, the baby can be delivered anytime. So, share this information with the friends who are going to be pregnant or are already pregnant. This information can help her to know about the whole process of pregnancy. Take care. Bye-bye.